I'm Professor Nicholas Osei-Journey, and I'm a consultant cardiologist at the University of Wales in Cardiff. And I happen to have developed an interest in heart disease, and that's why I'm a cardiologist. The heart consists of different structures. It's got the electrics, it's a pump, it's got arteries that feed it with glucose and oxygen. It's got valves, and all these various structures can be diseased. So when one refers to heart disease, I suppose they're generally talking about the arteries and the furring of the arteries. And the reason why arteries fur up is a relationship between genetics or family history and what is known as environmental factors. We're talking about cigarette smoking, we're talking about high blood pressure, we're talking about diabetes, cholesterol, and being overweight. If you've got disease of one area of your arteries, you're more likely to have it in another place. The same processes that leads to furring up of arteries in the heart are exactly the same processes that lead to furring up of arteries in the brain, in the kidney, in your legs, and indeed in every other part of your body. You often find that erectile dysfunction is the first sign of vascular disease in general, but heart disease in particular. Erectile dysfunction is defined as the inability to either maintain or get an erection that is sufficient for satisfactory sexual intercourse. 75 to 80% of those is because of something related to the arteries that supply the penis. When the arteries supplying the penis start to fur up, because the size is so small, you very rapidly get erectile problems. There is a UK study suggesting 13% of all men have erectile dysfunction. If you look at diabetes, anything from 50 to 75% of diabetics have got erectile dysfunction. In my own study of patients in our cardiac rehab, that was 60% of our cardiac patients have got erectile dysfunction. There's a crucial message. A man with erectile dysfunction has got vascular disease until proven otherwise. The flashing lights ought to come up as soon as you get problems with erectile dysfunction, because the clock has started ticking. You are a ticking time bomb. The good news is that we can both manage erectile dysfunction and hopefully stop you getting a heart attack or a stroke. The first thing in terms of managing erectile dysfunction is managing your risk factors. You say to a man, look, stop smoking, otherwise you're going to get a heart attack. They don't listen, they're not interested. You tell a man, look, you're going to lose your erections, and they sit up and listen. If you smoke, you've got to stop smoking. Diet and exercise is crucial to keep both your blood pressure down, your weight down. If you suffer from diabetes, it's very important that you have very good diabetic control. There are tablets that you can take to help both the heart and your erectile problems. But if the arteries are totally clogged up, no amount of tablets is going to work on their own. I mean, it's the same as the heart. If your heart is 95% blocked up, you can take all the tablets you want. It's not going to work because there's so little blood going to the heart. And if there's very little blood going to the penis, you can take all the tablets in the world. It's not going to work. You need to change your lifestyle. Us men just simply don't want to talk about it. If there's anybody listening, and you've got erectile problems, you're not on your own. It really is very common. It's important that you seek help from a medical practitioner for two reasons. One is that your erectile problems can be helped. But more importantly, use that as a warning sign, because it is a warning sign that there may be something more important going on in the rest of your blood vessels, particularly to do with the heart. And the earlier you seek help, the less likely you are to have a heart attack. I mean, it's as serious as that. The message is very clear. Save your sex life and save your life, and don't die of embarrassment.